Welcome back. In this video we'll be talking about the common childhood psychiatric disorders. We'll talk about the following disorders and we'll see a video of each so we can understand how the disease presents in real life. So first let's talk about attention deficit hyperactivity disorder. From the name you get the symptoms. The child would have attention deficit and hyperactivity. It's also important to know that the symptoms start before the age of 12 and that child will have the same symptoms all the time whenever he goes to school or stays at home. Usually these children would have normal intelligence but face some difficulties in school. 50% of those children will carry these symptoms to adulthood. To treat ADHD, we give stimulants like methamphetamine, but somebody would ask, why are we giving stimulants to somebody who is already hyperactive? And the answer is that methamphetamine and other stimulants will sharpen the attention. So the treatment is more focused on treating the attention part rather than the hyperactivity part. This is a fantastic video where a lady is asking questions to an ADHD kid and a normal kid. Here's what I want you to do. So I want you to start the video from the middle and I want you to try to figure out which kid has ADHD and which kid is the normal. I'm gonna put the link of the video in the description down below.
Time with my little sister.
How long does it take you to do your homework? A long time or a short time?
Maybe 5 or 10 minutes. I don't know, sort of in the middle.
Alright, so now let's talk about autism. So the onset age of autism is usually less than 8 years old. So just remember that autism is like 8ism, so 8 years old. And to remember the symptoms, I remember the mnemonic REPO. So R for restricted interests, I for intellectual disability, P for poor communication, and O for odd rituals. A really interesting part about autism is that some children will have what's called a savant. Because they have a restricted interest, most of these kids will spend most of their time on one activity or one hobby. So after a very long time of doing the same hobby or the same activity over and over again, they will master some unique skills in this activity. And we call this savant. Here is a video of Stephen Wilchert, who is an autistic patient with some unique, very interesting savant. If you haven't seen his video before, I highly recommend watching it. I'm going to put the link in the description. Rett syndrome is an X-linked dominant disease, and we only see it in females because the boys would usually die in utero. Symptoms would start before the age of 4. And remember that Rett cannot write because they would have intellectual disability and ataxia. The typical Rett syndrome ataxia is called hand-wringing. Here's a girl with Rett syndrome showing the typical hand-wringing sign. Now let's talk about Tourette syndrome. So Tourette syndrome usually starts before the age of 18, and the symptoms will persist for more than 1 year. And they would have the classical tics for Tourette syndrome. They can be motor, as sudden random jerking of some muscle, or lingual, which is also called coprolalia if the patient was screaming random words, especially curse words randomly. Usually Tourette syndrome patients would sometimes have OCD or ADHD. We treat them using antipsychotics. Here's a patient with Tourette syndrome, and you can notice the sudden ticking of his arms, the sudden movement, and the sudden shouting of curse words. Separation anxiety would present in children less than 10 years old, and they would usually have an intense fear of separation. This would interfere with their schools and disrupt their grades. We use non-medical treatment as play therapy and family therapy. Oppositional defiant is showing hostility to any authority figure, so like parents or elder sister or teachers in school or whatever. It's important to know that patients with oppositional defiant will not break any serious laws or any social norms. So although they will be aggressive most of the time, they will not break any laws. Conduct disorder, on the other hand, will break many laws while violating the basic rights of others. We only diagnose conduct disorder if the patient was less than 18 years old. If he was more than 18 years old, we call them antisocial. Alright guys, that's everything I've got. Hopefully I made this easier for you, and see you guys later.